All right, so idiopathic intracranial hypertension, also known as pseudotumor cerebri. So we've talked about this a little bit. Very classically going to be a young, obese female. Okay, so young female, also kind of in that same category with migraines. These patients will have more non-specific headaches, usually not unilateral, localized to one area. But the big thing that you're looking for in these patients are signs of increased intracranial pressure. Okay, bilateral symmetric papilledema is very classic. Usually they're going to show you fundoscopy, and you're really going to be looking for blurred margins here of the optic disc. Okay, so you can see the swelling of the optic disc, and I also added a normal image here of fundoscopy just for you to compare the two. But this will be very classic. If they show you fundoscopy and you see papilledema, start to think about idiopathic intracranial hypertension if you're trying to figure out your differential here in a headache question. Some other things they might say, oh, the patient complains of diplopia. Well, that might be not because they have aura per se, but because they have a lateral rectus palsy. Remember, cranial nerve 6 is classically going to be the first cranial nerve that's affected when there's going to be increases in intracranial pressure. Okay, that's particularly high yield. The other thing these patients will sometimes have is pulsatile tinnitus. So they'll kind of hear this whooshing sound that's very distracting, interferes with their sleep. Okay, and they can also have transient visual disturbances. But again, like I said, the diplopia and the visual disturbances are more so because of the increases in intracranial pressure, more so than there actually being any aura like we saw with migraines. The other thing, just going back to the ICP here, the thing that they'll sometimes say is, when this patient coughs, right, the symptoms are going to be worse. Or when the patient, bends over to pick something up, right? Whenever there's an increase in, typically when we're doing any kind of Valsalva, okay, whenever we do any kind of Valsalva, the symptoms tend to worsen. So all of these things will tend to worsen the symptoms, and that's because all of these things are causing further increases in the intracranial pressure, right? When the patient lies flat, right? That's another example. Okay, and again, classically in women, we already said young obese female, and sometimes they'll also ask about, vitamin A use, excessive vitamin A use being a classic risk factor. So just kind of be on the lookout for that. It's kind of one of those one-off things that comes up occasionally. In terms of the management, though, again, for pretty much all of these, the MRI is going to be generally unremarkable, right? Because, you have to differentiate this from stroke, or, in the case of a patient that has normal pressure hydrocephalus, right? That patient, if you did an MRI on that patient, you'd see ventriculomegaly. But a patient that has normal pressure hydrocephalus will typically be an older patient. And where this gets tricky is if you do a lumbar puncture on this patient, it's going to be therapeutic, right? Because when you take off some of the CSF, the intracranial pressure is going to come down. So these young females that have, idiopathic intracranial hypertension, when they do the LP, they're going to feel better when a large volume of fluid is taken off, which is the same thing that happens in normal pressure hydrocephalus. When you do an LP and you take out a lot of volume, the patient feels better. The difference is when you do an LP on a patient with idiopathic intracranial hypertension, the opening pressure is elevated. With normal pressure hydrocephalus, it's just like the name says. There's normal pressure, so there's not going to be an increase in the opening pressure. And not only that, like we said, in NPH, or normal pressure hydrocephalus, they're older patients. These are young females. Classic treatment modality to remember is acetazolamide, which remember is a carbonic anhydrase inhibitor. So it's kind of a very unique form of treatment. You can also see these carbonic anhydrase inhibitors used to treat things like acute glaucoma is very classic as well.